All right, I think we are good to go. All right, good afternoon, everyone. It is a pleasure to be back with you now here at the kickoff of fall in what has proven to be an ongoingly uncertain future when it comes to this unbelievable COVID virus. But I want to start with the good news. As of last Friday, the CDC had Maryland as having had the lowest new case rate in the entire country. And I think that is something that is definitely worth celebrating and remarking. I think there's probably lots of reasons why. Certainly our vaccination rates have moved forward. Certainly there are gaps that I'm sure we'll talk about today, but I think it is a really important note to make to highlight the fact that Maryland is holding strong, and Marylanders are doing the things that they've been asked to do, even at times when it has felt frustrating or otherwise. Marylanders have held strong. So we are moving forward, hopefully successfully. I think there are a lot of big questions for what happens with the colder weather coming along, the booster shots, what happens with schools, and hopefully when kids can get access to the vaccine. So there's a lot of lingering, outstanding questions out there. But I do think it's really, really important that we highlight that Maryland is moved to the front of the pack when it comes to stopping the spread of COVID. And it's a testament to Marylanders following doing what's best for each of us, that it ends up being best for all of us. And so with that, we are going to have a presentation from the Department of Legislative Services. Again, this is Ms. Tanya Webb from the Program or Office of Evaluation and Program Management in the Department of Legislative Services, followed by the Secretary, and then we'll have questions from senators. Oh, there we go. I think we have the presentation almost ready. There it is. So without further ado, and just as we're getting that up, we will have the Secretary. I will ask a few questions, then we'll have Senator Lamb, Young, Eckert, Washington, Rosapep in that order. And so we'll do about 5 minutes apiece once we get to that point. So if we are ready with the presentation for Department of Legislative Services, we can full screen that. Ms. Webb, the floor is yours.
Thank you. Good afternoon, everyone. I will be presenting OPEGA's analysis of Maryland's progress and status regarding COVID-19 vaccination. The analysis was conducted using publicly available data, primarily which came from Maryland Department of Health, as well as the Centers for Disease Control and Prevention. The presentation will cover COVID-19 trends, vaccination trends, state comparison, and equity. Since December of last year, when vaccinations became widely available, the state has experienced a decline in the number of tests, in the number of positive cases, as well as percent positive. However, over the last couple of weeks or so, the state is experiencing an increase in the number of tests. Next slide, please. From June 28th through August 21st, there was an increase in positivity rate. However, that rate has since declined. If you would please make note of the dashed line, and that indicates the start of the new school year for most public schools in the state. Next slide, please. This graph represents case rates by zip code. The larger the circle, the higher the population. The darker the circle, the higher the case rate. Since August 20th, the state has had 40,000 new cases, and the highest case rates are currently in Garrett and Wacomico counties, with the lowest case rates being in Montgomery County and Baltimore City. Next slide, please. Again, take a look at that dashed line, which represents the start of the new school year, again, for most public schools in the state. Since the start of the new school year, the highest rate of increase in the positive case rate has been seen in our school-age children, children who are ages 0 to 9 and 10 to 19. Next slide, please. This slide shows a breakdown of new cases by race and ethnicity. Next slide, please. The lowest death rate we've experienced here in the state has been 1 a day. However, recently that death rate has climbed to 15 a day, or about 100 deaths per week. Next slide, please. Around the 4th of July, the state experienced roughly 100 hospitalizations. Since then, as of September 24th, the number of hospitalizations is around 800. Next slide, please. The state had a high of roughly 65,000 doses administered in April. As of late, that number is around 8,000 doses per day. And just keep in mind that this data that we're presenting does not include Marylanders who have been vaccinated either through the federal program or in another state or DC. Next slide, please. This shows vaccination rates, either the first dose or single dose by zip code. The larger circles represent a larger population. The darker the circle, the higher the vaccination rate. Next slide, please. According to the CDC, in Maryland, roughly 70% of the population has received a first dose. 64% of the population is fully vaccinated, and that includes the second dose or the single dose of Johnson & Johnson vaccine. So that means that Maryland is 12th out of 51 in regards to the percent of the population that has received a first dose. Maryland is 7th out of 51 for the percent of population that is fully vaccinated. Next slide, please. The daily first dose vaccination rates are the highest for Latinos and African Americans. Next slide, please. The daily fully vaccinated rates are again highest for Latinos and African Americans. Next slide. About 95% of Marylanders 70 to 79 have gotten a first or a single dose. Next slide, please. About 85% of Marylanders who are at least 80 years old have received a first or a single dose. Next slide. Of the state's largest jurisdictions, Prince George's County has the highest rate of first doses. When you look at the remainder of the state, recently, Allegheny County has the second highest rate of first doses. Next slide, please. This is our last slide. And what we have here is a representation of cumulative and recent first doses. So we have, it's broken down in quadrants with above average, below average, so on and so forth. So if you take Prince George's County, for instance, they are located in the upper right-hand quadrant of the graph, and they have an above average cumulative as well as an above average daily vaccination rate. If you look at the lower left-hand corner of the quadrant, that's where your below average cumulative and also your below average daily vaccination rates are, and you'll see located in that quadrant, Garrett and Wicomico County. So thank you for your time. That concludes our portion of the presentation.
Thank you so much, Ms. Webb. That is an interesting change on Allegheny, especially. I'm curious what happened there. I'm sure that's something maybe the secretary, I don't know if the secretary plans to bring up, but that's an interesting shift. They've moved over to that right-hand quadrant. So interesting to hear what's working there. Well, let's not delay any further. Mr. Secretary, the floor is yours. Are we able to make sure that the department's presentation is being shared? Does the Deputy Secretary have that?
Pulling that up as we speak, Mr. President.
Perfect.
All right. President Ferguson, thank you, and good afternoon, Senators. As always, appreciate the opportunity to update you on where we are with our COVID-19 response and recovery operation. A lot has happened since we met last in mid-August. If I could get the first slide, Webster. I'd like to begin with our latest vaccination numbers, which build on what we heard just a minute ago. I'll try not to take too long, but to date, we've administered more than 7.85 million doses of life-saving COVID-19 vaccines. We also have 83.4% of all eligible Marylanders 18 and over have at least one dose, and nearly 75% of all eligible Marylanders 12 and older are fully vaccinated. In addition, we've been very focused on vaccinating, and we're up to 95.5% of our 962,000 residents who are 65 and older. And we're still a national leader on the vaccine equity front as well. We rank 6th in the nation for vaccinating the state's share of the Black population and 6th in the nation for the Hispanic population. Next slide. In addition, we've vaccinated nearly 72% of our 451,000 citizens who are 12 to 17 years old. On Labor Day, our VAXU scholarship program to encourage 12 to 17-year-olds to get vaccinated concluded with the drawing of 4 final winners. During that 8-week period of the VAXU campaign, we increased the vaccinations by 17% among that age group, which was very encouraging. In addition to doing their part to get vaccinated, 20 young Marylanders won $50,000 scholarships because of VAXU. And we're really proud of them and all the 12 to 17-year-olds who are vaccinated. And Mr. President, I wanted to especially thank you. You first proposed this idea and then worked with us to make it a reality.
Thank you.
You're welcome, sir. Next slide. We did not achieve any of these outstanding metrics by chance. Where we are as a state reflects Governor Hogan's proactive leadership, our priority together to protect our most vulnerable citizens, our focus on equity, and the fact that Marylanders are doing what it takes to keep themselves and their communities safe. As I have said during these meetings, however, our work is far from done. Because we are so well vaccinated, we have withstood the Delta variant surge better than other states, but we can't afford to be complacent. The operational organization that we have built, retooled, and are refining daily is enabling us to nimbly plan, prepare, and take decisive actions to stay in the fight over the next days, weeks, and months. As I've said before, we have stayed focused on the 5 pillars: testing, contact tracing, vaccinations, maintaining surge capacity, and ensuring sufficient PPE. If I could get the next slide, Webster. The good news is we have whittled down the number of unvaccinated Marylanders to less than 1 million, and nearly half of them are Medicaid beneficiaries. We expect and are working with our managed care partners to get more of these individuals vaccinated. We have a good understanding of who the unvaccinated are, where they are, and will continue to do all we can to vaccinate them and leave no arm left behind. 10 weeks ago today, we began publicly announcing the top 10 and bottom 10 nursing facilities in the state ranked by percentage of staff with at least 1 dose of COVID-19 vaccine, and facilities that did not submit adequate vaccination data required by the state. To date, nearly 90% of the residents and more than 86% of the staff at nursing homes are vaccinated with at least 1 dose. They are truly a shining example in the state, and we are grateful for all of them. However, there are still a few dozen nursing facilities that are not complying with the safety measures we put in place. It is unacceptable that a few outliers are seemingly willfully not doing what the majority of nursing home facilities in the state are doing to keep our most vulnerable citizens safe from COVID-19, and we are going to continue to increase our enforcement measures for those who do not comply. On September 8th, we authorized administering additional doses to to all Marylanders 65 and older who are living in congregate care settings. This was a science-supported and data-driven decision from an antibody testing program that we launched in August to ascertain nursing home residents' current levels of antibody from COVID-19. The findings of the pilot program, which is one of the first of its kind in the country, included more than 500 residents from across the state and indicated that more than 60% of the residents demonstrated some form of waning antibodies over time, and as many as 1 in 3 were particularly vulnerable. We discussed the findings with the CDC, who incidentally followed a week later with their additional shot recommendations. Good news is more than 57,000 immunocompromised Marylanders have already received an additional shot. Now let me talk briefly about monoclonal antibody treatment. To date, thousands of doses have been administered in the state. Because it's so important, we are renewing our outreach to strongly encourage physicians to offer monoclonal antibody treatment to people who are infected with COVID-19. We're also encouraging Marylanders who test positive for COVID-19 or who have been exposed to someone with COVID to ask their physician about monoclonal antibodies or go to one of more than 80 facilities across the state that are administering the treatment. At the moment, Maryland has sufficient supply of monoclonal antibodies on hand. In addition, just last week, with the support of the Board of Nursing, we took steps to bolster Maryland's nursing workforce by giving hospitals maximum flexibility to mitigate staff shortages by accepting registered nurses and licensed practical nurses from other states, in addition requesting early graduation from nursing students. We have also begun administering shots to those now eligible per Friday's CDC guidance regarding boosters for select recipients of the Pfizer vaccine. I'll touch on this topic in a moment, but first I want to touch on the K-12 school support. If I go to the next slide. Well before our students returned to K-12 classrooms, we took several proactive steps to make sure our schools have access to state and federal resources needed to keep our children safe from COVID-19 throughout the school year. During the past 12 months, the state has made more than $120 million available to local school systems to assist them with reopening safely. Since March of this year, all K-12 schools have also been able to participate in the Department of Health's diagnostic testing program. In addition, 14 public school systems and 80 non-public schools in the state have applied to be part of the screening testing funded by the $182 million made available through CDC's Enhanced Laboratory Capabilities Program. And in July of this year, we partnered with the Department of Education to offer this assistance to schools through emma.maryland.gov, which we put online. We again extended the application period to October 10th of this year to enable even more schools, systems, and non-public schools that have not yet applied to take advantage of this opportunity. Beyond these funding supports, during the past 18 months, local school systems across Maryland have received more than $2.7 billion in federal funds to create a safe learning environment to keep schools open. Next slide. Before I conclude, I want to share where we are with providing Pfizer booster shots and who is eligible per the new CDC guidance. This includes anyone over 65 years old, any residents 18 years and older in long-term care settings, anybody 18 to 64 at high risk due to underlying medical conditions, and 18 to 64-year-olds in an occupation or institutional setting that increases their risk for exposure. And that would include first responders and teachers. These individuals are eligible for a Pfizer boost 6 months after they completed the full Pfizer series, meaning after their second Pfizer shot. Operationally, we have ample supply of the Pfizer vaccine and the capacity to provide Marylanders with a booster shot via our robust network of hundreds of locations across the state. That includes pharmacies, local health departments, primary care physicians, mobile vacs, and elsewhere. And on Friday, we distributed a bulletin directing vaccine providers in the state to immediately make booster shots available to eligible Marylanders. We have a robust communications plan to proactively encourage those who are now eligible for a booster shot to get one. This will be through our call center, which we together earlier in the year put together, and that's through 855-MD-GO-VAX. We also have GO-VAX Maryland television spots, radio advertisements, and social media. We've also begun preparing to do the same when booster shots are authorized for the rest of the Pfizer recipients, and we are hopefully expecting booster shots for recipients of Moderna and J&J very soon. And lastly, we want to continue to call on the federal government to expedite the approval of the COVID-19 vaccines for 5 to 11-year-olds. We're currently in the planning process and will be ready when they are deemed eligible. Again, thank you for the opportunity to update you, Senators. I'll stop there, Mr. President, and happy to take your questions.
Thank you, Mr. Secretary. Appreciate the rich presentation and filled with information. I've been trying to think about what the appropriate competition should be for the 5 to 11-year-olds, and the only thing I can land on is Roblox Robux. So if you're not familiar with what that is, you must not be the parent of a 5 to 11-year-old. I can assure you it would have people lining up across town to get Robux. But in all seriousness, appreciate the work. I think that the college scholarship program really, so 17% jump is significant. So I'm glad to see that, if we can find innovative ways to get people to get those shots in the arms, the better. Two kind of general areas of questions. The first is sort of a general testing question. I do want to add on the school component. I know that the administration has made testing available in many, many places. Pharmacies have taken it on. I wanted to flag that there is, I've gotten an increased number of constituents who, if a child has been deemed to have been exposed, kind of in the search for a quick turnaround test, those who have it at the school environment are able to get it quickly there. Those who do not have the school testing, it has been a bit more of a hodgepodge scenario. And you have a clinic open that's 2 hours on every Thursday. You have another one that may be open only on the Saturday afternoons. And so the other component that's, I think, confusing is the varying time that it takes to get a response or to get a test back. I think I may have mentioned before, I always recommend the Annapolis testing site to anybody that asks, because it's the best one out there and it's reliable, and it's the one I've used throughout. But unfortunately, that is not that level of certainty isn't quite available, and I don't know to what degree or what lever can be pulled. But I do think that as the fall comes, sadly, I suspect there will probably be a higher demand for tests, and so just want to flag it now. On the school side, I appreciate the information on the 182 million. It sounds like that not every district has applied, and my understanding is that the department sort of set the target at $42 per student, so it was being allocated. And is that going to be sufficient statewide? And if districts do not end up applying and using for what the $42 per student was allocated, will that be reallocated for those that did apply?
Well, we're still urging the other 10 school districts to apply, and they can choose one of two options. They can use the contractors that we've put in place, the 5 of them, or they can apply for reimbursement. What we know for sure is that with the contractors that we put in place, they also have labor that will help with it. So people don't have to worry about getting somebody to come and help administer the shots. We have heard that there's a desire to also have people making phone calls and getting the releases done, but we have money also built in to a non-clinical contract to be able to provide that support. So we believe that we've got plenty in place to help the school districts. Those who have put their own capability in place are welcome to apply for reimbursement, but in order to be fair, we did a per capita across the state which is about $42 per test.
Do you anticipate potentially reassessing the total amount after the 10th, after the RFP closes, or the
Well, absolutely, we'll do that, and we expect. But by the way, this $180 million is a 2-year grant, so it's we budgeted for $90 million for 2 years. And the reason we extended it is we really want to encourage every school system to participate, as well as the non-public schools. But we'll monitor this week over week as it starts to unfold.
Great, excellent. Secondary question about the boosters. Everything is focused on Pfizer. The Moderna, I guess, is not in the queue for booster anywhere. Is that correct? That's a question that I've gotten.
That's correct, except for we put in place the ability for those who are in congregate settings or immunocompromised to receive an additional shot of both Pfizer and Moderna. And I can assure you, I'm anxiously waiting for Moderna to be approved for myself. I'm over 65, but I'm not eligible yet. So
well, I hear that it's lasting longer, or theoretically.
What's that, sir?
It lasted. Well, who knows? I don't want to say it because I don't know that to be true. So I don't want to spread misinformation.
It's going to be soon, though. We're pushing.
Yes. Last, Allegheny. I ment to ask about Allegheny. Did something change in Allegheny?
We have been pressing the 3 counties, Washington County, Allegheny, and Garrett. And I've been doing quite a bit of media out there. We've been talking to the folks, and what we've been pressing, quite frankly and tragically, the vast majority of the deaths that we have been seeing are unvaccinated people. And so we've been saying that very publicly. If you're not vaccinated, your chance of dying goes up dramatically, and we're tracking that. And so we're hoping that, I can't take credit for that, but we're hoping that the interventions in Allegheny have reached those folks, but we still have some outliers.
Great. Well, it's a promising trend, and hopefully we can keep it moving. All right, let's go into Senator questions. We'll give about 5 minutes apiece. I think we have time for 5 minutes each. We'll start with Senator Lamb, and then we'll go Senator Young, Eckert, Washington, Roosevelt. So Senator Lamb, the floor is yours.
All right. Thank you, Mr. President. And Mr. Schrader, good to see you again. Thanks for joining us. I had a question. I wanted to focus on students and particularly our schools. So I think according to the information that the Department of Legislative Services presented earlier, only about 62% of teens age 12 to 17 are fully vaccinated. And with the administration now focused on boosters, I'd like to know what's being done to increase the percentage of teens who are being fully vaccinated beyond just the scholarships, for example. Are there other specific examples that you can point to that the department is undertaking to try to vaccinate those who are 12 and above in schools?
Yes, and we'll have to double check those numbers because our data shows it a little higher, close to 70%.
I think that's for at least one dose. I was talking about fully
one dose. Yeah, yes, that's correct. But getting back to your point, we have 2 tracks of priority. Obviously, the booster track is protecting the vulnerable population. Those are immunocompromised, those are in congregate settings, 65 and over. But the other track is to very aggressively find and vaccinate the 970,000 or so people who still don't have their first dose. So although we're very focused on the one, we're still very aggressively going after the other. And now that school's in place, we're working with the school systems, obviously on getting ready through 5 through 11. But I'd like to see us working closely with the schools to do the 12 to 17 also. So that's one of our objectives.
Yeah, so I would too, because those younger age groups, particularly those 0 to 19, now have the highest case rates, as you saw from the data that was presented earlier. This exceeds all other age groups in terms of number of new cases that are rising in their rates. I think you do have a tool. There are only certain things that can be undertaken in schools, right? So masking, and that's now in place. Physical distancing, which is challenging in some of these schools because of the space. Air filtration, circulation, which we've touched on earlier in a prior committee hearing as well. testing, which you also touch on, and that's in conjunction with contact tracing and quarantine, as well as vaccination. And you mentioned that there are efforts through these grants to be able to increase testing in schools. I think that's helpful. I would like to see this rolled out across the board for all school systems, but in particular for vaccination, you do have the tool to be able to require vaccination of students going into schools. Is that right? Is that something that you're looking at?
Well, we are looking for, let me back up a step because there's two different issues here. We have been working with the schools to get their routine vaccination numbers up because we have found that because of COVID, that vaccination rate has been lagging behind in many school systems. And we have recently extended the date by which school systems have to do that. You know, of course, they ask us for an extension, but we've told them that they can have an extension. So we're very concerned about getting routine vaccinations back up to speed. While we're having those conversations, we're also talking about 12 to 17 to see if we can work if the school, because we really need to rely on the schools to help us with this. They're autonomous, and we want to make sure we respect that autonomy in working with them.
So it sounds like even though the department has the tool, because I asked this at the last briefing that we had last month, under the education code, MDH it says that the Maryland Department of Health shall adopt rules and regulations regarding immunizations required of children entering schools. And the department has done that with these other vaccines. It sounds like the Maryland Department of Health, and under the authority that you have, you're not looking to use that as a tool to increase the vaccination rates of teens in our schools. Is that correct?
Not at the moment, but you raise an interesting question. Are you advocating that we would make the 12 to 17 COVID with Pfizer a part of the required vaccination regimen within schools?
I think that would be one way to increase the vaccination rates in our schools. Because those are folks that FDA has authorized to be able to be vaccinated with these vaccines. And we see, as you mentioned, whether it's 62% having been fully vaccinated or 70% or so having a first dose, we're still falling short. And that's the fastest rate of case increases that we're seeing across the state. So, and I've seen patients where there are parents that have gotten COVID from their kids. And so I am concerned about the spread of COVID in our schools, and you have a tool that you can use as the secretary to require this to be, require vaccination of students coming into our schools, but it sounds as though it's not reaching for this tool or is not willing to do so.
Yeah, no, you make a good point, Senator. I mean, our first focus right now has been getting the routine vaccination rates up because there's still other, particularly for kindergarten and 7th grade, we want to make sure that those are taken care of. But we'll go back and take a look at your suggestion.
Yeah, I'm all for the routine vaccination rates, but we're in a pandemic, and this is a COVID pandemic. So we need folks to get vaccinated. We need students in our schools to get vaccinated for COVID. And I brought this up in the last briefing last month, and you weren't sure that you had the authority to do so. And it sounds like this month, you're still uncertain and not willing to explore that as a possibility. I hope that next month you'll be able to bring back some additional considerations as to how you can improve those rates in schools through a mandatory vaccination program in conjunction with MSDE.
All right. Thank you, Senator. On to Senator Young. Senator, I think you are on mute. You're going to have to unmute yourself quickly.
Just a quick one, then I'll get on to the more serious thing. When I was looking at the graphs, it was said that the African Americans and Hispanics were at the highest rate, but the graph looked like the Asians were way up above everybody else. Did I look at the graph wrong, or
So was that? Are you referencing the Department of Legislative Services graph potentially? Let's see if Mr. Powell maybe.
I think it's the weekly vaccination.
Yeah, well, sorry, I'll try and clarify that, Mr. President and Senator Young. I think what you're referring to is the recent rate of first dose vaccinations by race and ethnicity, and it is slightly higher, I think, for Black or African American and Hispanic or Latino Marylanders than it is for others, but that is the recent rate. The cumulative rate I don't have in front of me, but I think MDH has that on their website, and that's something I can take a look at and share with the work group.
The graph we looked at, we looked at two graphs that had Asians way above everybody else. So I didn't know if that was daily, weekly, or overall, but the graphs I saw, they were way up there. I guess I just want to say I think you've done a pretty good job, but I'll follow up first with Senator Lamb. Being the oldest person here, when I was in school, they lined us up for polio and smallpox, and we got them. There wasn't any question. They lined us up and they went down the line and we all got them. And I think we have the authority to do that. And I think if we want to break this thing, we've got to start taking more bold steps, not just here, but everywhere. This thing's going to come back again in 6 months if we keep letting 20, 25 and much higher in other places, people go unvaccinated. So I just got back from 3 days in New York. Every museum, every restaurant, every show you went to, you had to be masked. You had to show that you'd had both vaccinations and your ID to make sure they were actually your vaccination, or you didn't get in. And it didn't hurt business. The restaurants were booming. Had dinner at Tavern on the Green one night. There were 200-300 people outside and 100 or so inside. Everybody showed it to get in. So I look at that, and then again, why can't we require that every teacher has to get it? Every nurse or doctor in a hospital has to get it. And I take that on to employees like restaurants and grocery stores that are in contact with everybody. I know we can't mandate somebody get a vaccination, but we can make it very difficult for them to go out in public and do anything if they don't have one. And I think that's what they're attempting to do in New York. And I think personally, that's a faster way to get us where we want to go. Have you considered any of those things?
Well, as I told Senator Lamb, we'll definitely take that on board. We've been reluctant to force people into doing these things. We've had a lot of success so far, encouraging, cajoling, educating. We have been more aggressive, I'll admit, in the nursing home industry and the assisted living industry. But we'll take that on board and appreciate the advice.
Yeah, just real quick. My point is we can't make somebody get a vaccination, but we can make it very difficult for them to do anything and go places if they don't do it. And I think that's working in New York right now. I don't know where they stand, but I was impressed when I was up there.
Yeah.
By the way,
but one of the things we have done in the nursing home industry, we've gone to requiring weekly testing if you're not vaccinated. So in the cases where the most vulnerable citizens are, we are using some of those. But I hear you about the general population.
okay.
All right. Thank you, Senator Young. On to Senator Eckert.
Thank you very much, Mr. President. And Secretary Schrader, thank you for all your information. I live in an area where I'm debating with people regularly, even the validity of the vaccine. And I haven't figured out what kind of accurate information I can give people any more than I already have. And that leads me to, I guess, my bigger question, that with so many people who are working at healthcare facilities who are unvaccinated, including a lot of upper level professionals who are very outspoken about the validity of the vaccine and the illness. What are we going to do for those facilities, particularly our hospitals, where they're having such an increase of patient cases where they need to provide care, and at the same time they do need to expand their testing? Is there some backup plan, Ms. Secretary Schrader, that you have to be able to assist those facilities who are already short of staff to continue that level of vaccination and booster effort?
Well, I'm going to go back to one thing I said and then talk about another initiative that we've got underway. Particularly in the nursing homes, we have had a measured process over the last 5 months, and we have seen those staff vaccination rates climb steadily. And as I said, we are now over 86% of all nursing home workers with at least one dose or more. So we're very encouraged by those numbers, and that's been a steady process as we've kept the pressure on. There's 226 nursing homes in the state. We've seen over 90 of them now, or over 90% staff vaccination. And where we're focused for the moment is there's about 25 to 30 outliers that we're looking at. What are the next steps that we can take with them? So we have found by being very measured that has worked. The other thing we've done, and it just started 2 weeks ago, we're very concerned about the disinformation and misinformation that's out there. And we have started a daily process of putting out, we have a Twitter feed, and in that Twitter feed we're doing, that's COVID Vax. We are pushing out information to the general public, and then every other week, and we started last Thursday, we're bringing a medical expert in and doing a live Twitter feed to communicate to the public about information and disinformation. So we're going to be doing that every 2 weeks, plus in addition pushing out information. So matter of fact, Senator Lamb, I'd welcome you if you have an interest. Joel Frashone, we'll get you on one of our live Twitter sessions, and if you have information you'd like to push out, we'd be glad to do that for you. But we think that attacking the disinformation and the misinformation is a really key issue that we're going to attack, and we've started that over the last 2 or 3 weeks.
But back to the hospitals, what is your plan for helping our hospitals who are short of staff and need to expand their vaccination and their testing efforts?
Right. So just this past week with the hospitals, we have authorized them to have the ability to bring in licensed healthcare professionals who are out of state. The Higher Ed Commission has also asked the programs around the state to graduate nurses early, as we did last year. And we've also advised the hospitals and the nursing homes that they have the ability to bring certified nurse assistants, physician's assistants who are, who maybe their license expired. Under supervision, they can bring those people in. So we're working with them. The Board of Nursing has been helping us to, because we do need to help them increase their staff, because the medical workforce is really tired. They've been working long, hard hours for the last 18 months, and it's been hard on them.
I hear you, but I'm, with all due respect, it's taking so long for those things to happen. I've even been trying to get community health workers to be able to be indigenous and get out there, and I am stuck with access to programs to be able to get those workers who are available, but get them up and get them through a program and then get the kind of funding. We have workforce investment money that's sitting, and our locals are not using that to be able to address the need. And so I'm concerned, and I'm a little pushy, because the cases and the positives are continuing when we're trying to make some efforts to change that. but it's very frustrating when you just don't have the availability of folks in the pipeline to be able to provide the services. But whatever you can do to expedite that, and I would suggest to you, somehow get that accurate information to our businesses, get it down through the chambers, get it out there, because it's a lot in the business community who just are listening to other voices and are discrediting very verbally all that we're trying to do. Thank you. Thank you, Mr. President.
Thank you, Senator. The other news, I'm sure that Senator Lamb probably has experience with this too, is that I hear from the healthcare community that it's delayed care. And since the hospitals have been, that delayed care is causing greater hospitalizations of other non-COVID issues.
Correct.
So it's kind of having a double whammy. But Senator Washington.
Thank you, Senator Ferguson, President. Thank you for meeting with us, Secretary Schrader, and it looks really great. This numbers are increasing in African-American and Latino populations. But I want to, before I get into my question, just really echo very much what Senator Eckert is saying, and also Senator Lamb. I understand your reaction to bringing in nurses from out of state and incentivizing, but every state is doing that respectfully. And so we are going to be, you're putting, by just simply allowing the market, so to speak, to solve this problem. It's sort of not unlike what we did in the early days of COVID, letting the chains, letting, Walgreens, letting, these entities dictate distribution. And once the health department took a greater role in the health, in distribution, taking the recommendations of this work group as well as others, this more assertive Maryland-based approach. So I want to just reiterate that we have to address our nursing challenges in a Maryland way. And we certainly have people who are in this state now with given the proper support and training and funding can achieve that. So I want to strongly that we not do what everyone else is doing and really come up with a Maryland solution. So we look forward to working with you on that. But this has to do, I just wanted to follow up on a couple of questions. Our vice chair of our Education, Health and Environment Committee sent you as a follow-up to our August 30th meeting on COVID-19 protocols. And thank you for your response. But I wanted to, I guess, let the public hear more broadly, and also just to get a better understanding. And maybe it's not in this meeting, but I really want to better understand what the role is or the decision-making between MSDE and the health department. And again, this builds on the questions that all my colleagues are talking about when it comes to at what point are we going to mandate vaccines and how, but what really do you see your role in protecting public health in the school systems?
So we've been working with MSDE and Superintendent Chowdhury. Our public health folks have been providing advice in terms of options, and I think recently the state school board gave guidance to the school systems on masking. So we're being very careful not to be intentionally overbearing and allowing the school systems to take the lead in their individual jurisdiction. So we're being very deferential to them. We're giving them our guidance and our best advice, but we don't want to be interventionist in terms of school policy.
Right. So Secretary Schrader, again, I just want to bring you back to our early days, this local approach when it comes to a statewide public health crisis. You are our agency that we rely on to protect and be the lead in that. So to that, what specifically, another question that she had and the committee had was, You said that MDH is working with our school-based health centers. Could you give us some specific interactions, or what specifically are you doing to help the school-based health systems educate their communities, but also support their vaccination efforts? Because you said that school-based health systems are able to provide, centers are able to provide the vaccine. I just want to better understand how that works.
Yeah, we went back and looked at that. The school-based health centers are a small percentage of the capability. What we really are looking at is the possibility of doing school-based clinics, which is different, and we're going to be offering that support. But it'll be jurisdiction by jurisdiction. We have had some good success in Prince George's County and a few other counties, but we're doing that planning with them as we speak.
Thank you. I would call for you to stand up a clinic in every single jurisdiction in tandem with every single SBCH. I think that would be what we're looking for. And again, taking the lead, doing it. We have the money. Let's stand it up so we can get this under control. Thank you, Senate President. Thank you, Secretary.
Thank you, Senator. Senator Roosevelt.
Thank you very, very much. I'm just going to be real frank here. What I've seen done over the past 2 months is the state health department, the State Department of Education say the local school systems can require vaccinations. And I've seen the local school system, the superintendent says the state health department can require vaccinations. So we have the adults pointing fingers at each other while the kids are suffering and the parents are suffering. I would suggest that either you do what some of my colleagues suggested, that the state health department, state education take the leadership, because the local superintendents, for reasons that are very frustrating, I think, to parents, are not taking the leadership, but you have the power to do it. I would encourage you to use your power. If you still don't, for whatever political reasons, don't want to do that, I've got a couple other suggestions. One is, I confirmed this with your department of the AG's office today, local school systems can access the information from Immunet on which kids have been vaccinated. I would encourage you to aggressively work with the school systems to identify in every school which kids have been vaccinated and which kids haven't been vaccinated. So you can take your mobile vaccination units that you take to the school. This is being done in Prince George's schools. It should be done in every school, as Senator Washington said, so that you know who hadn't been vaccinated. You go into the classroom and say, okay, Charlie, you haven't been vaccinated. We're doing vaccinations in the cafeteria at 2 o'clock. You can take the lead on that without imposing it if you're not willing to impose it. Secondly, you could rate the schools the way you rate the nursing homes. Marylanders have information now about where their parents are in nursing homes. Are the ones that are safe or the ones that aren't safe? The state health department can do exactly the same thing for all the schools in the state, so every parent would know how safe their child's school was. A couple of suggestions if you're not willing to go with mandatory vaccinations. I'd appreciate, I'm not asking for a response right now, but I'd appreciate if you guys look at that and get back to us. I'm switching subjects. That was a suggestion. Subjects. As you know, President Biden has directed the Occupational Safety and Health Administration to require employers of over 100 employees to require mandatory vaccinations. And as you know, in Maryland, the OSHA law is administered by the State Department of Labor. I wanted to ask, where are you with the State Department of Labor in implementing the coming OSHA rule to get mandatory vaccinations with our major employers?
Yeah, we're working with the Department of Labor on that. We're aware of that. We haven't come to conclusions yet, but we are aware of that, and we thank you for. We'll follow up as we go forward.
If you would, and my second question is, what are you doing with the Department of Labor or others on the employers of under 100? Obviously, the reason that the president proposed the mandatory was to reduce the competitive pressure on the employers, which is a really good idea, very pro-business approach. He didn't do it on the small businesses, and I get that. What are we doing to get more small businesses to require vaccinations of their employees?
Well, what we have,
Senator Young said,
sorry, go ahead.
And also, frankly, as Senator Young said, of their customers, the way they're doing it in Philadelphia, the way they're doing it in New York very successfully.
Yeah, we have been offering mobile vaccination to the smaller businesses so that they don't have to bear the burden. We've had a recent experience with a number of Burger Kings in the Baltimore area. We're trying to recruit more small businesses. Our approach with them would be to provide them the support that they need because they're smaller, which is slightly different than those with greater than 100.
Again, I'd urge you to consider, you can do the same kind of ratings for businesses and places where people go. This is a business that has 100% of their employees vaxxed or not. That would be a competitive advantage for businesses if you had some system to call attention to the ones who are protecting their workers. Got one more last question, Mr. President, then I'll shut up. Testing. I've gotten complaints from my constituents about lack of access to convenient testing, just the way the president was describing it. And I did a little mystery shopping myself about 10 days ago. It was very hard in the College Park area to find the convenient tests. When I went to the CVS in my neighborhood and said, do you do tests? They said, no, we don't do tests. And I said, understand that. Where can I get a test around here? They said, we have no idea. Go online. That is not an acceptable answer. I would encourage you to get with the folks like the pharmacy chains and others who do tests to direct people and train people to make it easy to direct people where they can get a test. Last question on testing. I hear there's a lack of supply of tests. Is that correct?
I don't believe that's the case. We have, right now in Maryland, we have over 430,000 point-of-care tests ready to deploy that we've been sending out. We have a very good relationship with Abbott for Bionex Now because we were early in the process. They view us as a favored customer. We have a contract with them for about 800,000. So I don't think that's an issue. And we have plenty of tests through our PCR relationships with labs.
That's great to hear. It'd be good if you promoted that because there is word on the street that there aren't enough tests.
All right, we'll do that. Thank you, sir.
I don't think the president was saying that to me. Maybe.
No, sorry. Thank you. That was my daughter who ran inside to go check the laundry. So the joys of we're making it work. Thank you, Senator. The other just issue on that is, at least on the knowledge, and I don't know if there's any way to do some sort of disclosure, but how many days it takes to get the result has been a big variation. And that's something that's harder to manage. And I know that it goes up and down, but there's been a big difference between something that will take 7 days versus the 24 hours. And it's just at 7 days, it's kind of a useless test.
We have been monitoring that and we have crisp data. Our data shows that the vast majority of tests are 1 to 3 days. There's a few outliers in the 5 to 7, but not very many. The vast majority of tests are within 1 to 3 days.
Excellent. Okay. Well, look, thank you all. We are in this journey in an ongoing way. I think Maryland still remains to be in a very good place with room for improvement, and that's what we should be doing, is pushing to make sure that we're as safe as possible. So thank you all. We'll look forward to scheduling the next one. We will give all members notice and we'll connect with the secretary for the next oversight hearing. In the meantime, stay safe, get those vaccinations out, and we will see you all soon. Take care.
President, we appreciate it. Always good.